One last point of order, especially for people who are visiting from out of state, please drink plenty of water throughout the day. It's like 227 degrees outside. We don't want anybody spontaneously combusting, so make sure that you hydrate. We should formally introduce ourselves. My name is Jeff Tully.
My name is Dameff.
And it is amazing to be back here. This is a picture of us 3 years ago at graduation from the University of Arizona College of Medicine in Phoenix. We spent 4 years of our lives here studying, learning about anatomy, physiology, pharmacology. Some of the people in this room are the ones who helped us to become doctors. But as Dean Ramos said, they did such a great job of encouraging us to follow some of our extracurricular activities, which is really the reason that we're here today. So it's just a very special moment for us to be back here, and we really appreciate all of their support.
As I'm sure many people in the room can also relate with, we wear many hats. First and foremost, we're doctors. We finished up our residency training. Jeff is a pediatrician. He takes care of children. No, this is not a HIPAA violation. That is my son he's treating. I obviously trust him very much.
Christian is an emergency medicine doctor who has the privilege of taking care of patients on what is often the worst day of their lives. And these identities are very important to us. This is who we are. We are doctors, but it's not the only thing that defines us.
We're also hackers. And, did you hear an audible gasp?
There was a gasp.
Aren't these people in prison? What we want to challenge today is your conception of what a hacker is. We're going to talk to you about that. Jeff and I have been involved in cybersecurity for years now because it's been an interest to ours. And it just so happens to perfectly integrate with our clinical practice because we're able to identify a lot of new threats, see things from the point of patient care, and collaborate with portions of the security teams in an effort to make things better.
So just by a quick show of hands, who else here in the audience is a hacker today?
Come on, be proud.
That's pretty good.
There's
so for you guys, give us a few minutes. For the people in the room who don't reverse binary on a daily basis, we want to give those who didn't raise their hand the opportunity to kind of shift their perspective a little bit and realize that they too can be hackers, okay? Bear with us.
So what we're going to talk about is systems. Now, it's an elementary concept we're all familiar with, but let's just take a minute to pause and contemplate how many systems we interact with every single day. In medicine, they're often the smallest of cells, maybe an organ system, maybe the EMR system that we work on, the laws of physics, the lights that you use to drive here safely, the traffic lights, all the way to the software, hardware, firmware of the computer that we're presenting from today. These are complex systems. We invent new ones every single day, and whether or not we want to or not, they are vital parts of our existence.
And what a hacker does is understands the system through the act of breaking it down, figuring out what makes it tick, how the pieces fit together. And in doing so, hackers discover areas of weakness that we call vulnerabilities. Knowledge of these vulnerabilities can then be used when we manipulate the system. That knowledge is power.
This clicker doesn't like me. Here we go. The same process, if you take that thought experiment of understanding a system, deconstructing it, identifying its weaknesses to make it better or to do other things, that's what medicine is. Physicians do that every single day. They're hackers and they don't even know it. Our systems are not made of silicon. Instead, they're made of the human body, right? They're cells, they're organs, they're ligaments, etc. They're the biochemistry. We study that, find the areas of weakness in the human body. That's disease. And we patch those with our treatments. In many ways, we employ the exact same mindset and tool set that hackers use, which are that they understand technical systems very well, that are able to identify those weaknesses in the chain, and do something about it.
We see examples of different types of hackers all over medicine. So cancer doctors, oncologists, they will decode the DNA of a malignant cancer cell and use the information they learn to target specific drug therapies towards areas of biochemical vulnerability.
Surgeons are, I like to consider the hardware hackers, if you will, of medicine. Take, for example, this pitcher may injure a ligament in their elbow, and because of that, their ability to pitch a fastball is compromised. A surgeon can go in and physically hack that ligament, reattach it, in many cases, improving it. And so the pitcher after surgery can often pitch faster than they did before. That was a vulnerability turned to a strength.
So this is a key concept that we want to convey to those who don't deal with this every day. You can be a hacker and you can do great things. You can take your knowledge of vulnerabilities and use that to strengthen and even improve a system. And this is really the ethos that drives us as physicians. And I think we saw this picture on one of our first days of medical school. It's a beautiful painting. It kind of summarizes in one gestalt what we do as doctors every day, both at the bedside and from afar. We care for our patients. And of course, today's bedside is significantly different than the one depicted in this painting. We have incredible medical technology that allows us to care for our sickest and most desperate patients. And we are so thankful for that. It has saved countless lives with the promise to save even more and maybe even one day eradicate disease. This incredible gift doesn't come without a cost. And what we need to understand is that we may have some risks that we need to protect our patients from. Christian and I kind of think of technology and medicine as operating on two separate but equal pillars of care. We have the traditional technologies that will directly touch our patients, from the implantable devices like pacemakers or insulin pumps, to the equipment up into and including giant robots that we use to perform surgery in the operating room, imaging devices. All of these directly interact with our patients to help us understand and treat disease. We as doctors also rely on infrastructure that helps to support us in our mission. The hospital with the electronic medical record, telemedical systems that we use to take care of patients from afar, and even things as simple and taken for granted as the power infrastructure that keeps the lights on or the water that keeps the ORs clean. These are equally important and in some cases equally vulnerable.
So as I'm sure many of you in the room already know, hackers can use their power for good. Some of them use their power for ill, to harm our patients, essentially. And whether or not they actually intend to, or it's a byproduct of whatever they do, we know for a fact that hackers are targeting healthcare. How do we know that? Well, for years, we've had good hackers, many of which are in the room right now, hacking medical devices, hacking infrastructure, and showing us time after time that the systems that we trust every day to take care of patients are insecure, prone to attack, and potentially dangerous to our patients. So what we're going to do is we're going to take a little bit of time to just catch you up over the last few years of what's happened in this space. This is by no means an exhaustive list, but just so you can understand kind of what's been happening a little bit and get context if you're not already aware. This is Jay Radcliffe. He is a type 1 diabetic. That is an insulin pump in his hand. He requires this insulin to treat his diabetes. If he doesn't have it, he'll get sick and he'll die. He's also a prolific hacker, a very famous hacker in the medical device community. And he turned his skills onto his own pacemaker and showed the world that it was vulnerable to attack. That because of its connectivity, it was vulnerable to attack from a remote attacker. In 2012, Barnaby Jack, who is subsequently passed, was one of the first people to talk to us about hacking pacemakers. This spurred a multitude of other researchers to also investigate this space, and there have been periodic updates since this regarding a variety of different pacemakers. This was widely covered in the media and is one of those things that's commonly portrayed in pop culture, in fictional shows. There's always the rumor or the breath of something like Dick Cheney got his pacemaker replaced because they were concerned about cybersecurity vulnerabilities. Would we ever know that for a fact? I doubt it. Whether or not that's true, we don't know. But what we know is it makes great television, right? In 2014, so we're talking about hacking medical devices. What we also have to be very careful of is to talk about hacking medical infrastructure. Again, another pillar that we talk about. In 2014, the hacker collective Anonymous, and for those of you that don't know what Anonymous is, it's a loosely organized international group of hackers, if you will, that sometimes align on different hacking targets, if you will, for various purposes. Well, they turned their attention to Boston Children's Hospital and for multiple days attacked it. Now, this really changes the motivation, right? So we commonly get a question about why would anyone want to hack a hospital? There's sick people there. There are children there. Why would anyone want to do that? And as I'm hoping to demonstrate today, sometimes the motivations aren't obvious, or sometimes the motivations don't make sense in just making money. Sometimes there's a political reason why someone would want to hack a hospital. What we do know at the end of the day is that they are. In 2014, some security researchers at DEF CON talked about hacking 911. So again, some critical medical infrastructure that's vulnerable to attack, that it's antiquated, can easily be targeted, and because of that, it can be denied. The service can be denied. Meaning that if you call during a heart attack or a stroke, imagine getting a busy signal when you needed it most. And that's because the system is not very well secured. This is Billy Rios. He's also a famous hacker in the medical device security realm. He bought a device off the internet. He bought an infusion pump. And for those of you that don't know what an infusion pump is, it's a bedside device that is able to put medicine through and at a very specified dose, deliver that to the patient. It's thought as a safety issue, right? Because commonly patients will suffer from incidental overdoses or underdoses of a medication. If you attach an electronic brain to it, then it must be safer. And for the most part, that's the case. Infusion pumps have decreased the rates of accidental drug adverse events in hospitals. But this particular one that he hacked had some wireless connectivity features so that they could update drug libraries, et cetera. And because of that, he demonstrated how they could underdose, give no medication at all, or even overdose by a malicious attack. Widely covered again in the media, and an amazing kind of story about what you can find on eBay. No joke on that? This prompted for the first time in history the FDA to issue a warning for a cybersecurity vulnerability. Now, for the most part, the FDA issues warnings on an expired lot of drugs or some accidental glass that got in some medication, they'll recall it. But for the first time in history, probably mostly because of the Hospera hack, the FDA said you should not use this device because of its cybersecurity vulnerabilities. In 2016, some ransomware attacked a hospital. For those of you that don't know what ransomware is, it's a malicious piece of code that infects your computer. It encrypts your files, basically making them unreadable. At which point you're prompted to pay a ransom, a fee, if you will, for them to unlock it so you have access to all your pictures of cats. It inadvertently, or at least we believe inadvertently, spread to this hospital, Hollywood Presbyterian, and for multiple days wreaked havoc. The hospital paid the ransom. I don't even think that the people that made it knew that they hit a hospital. I'm almost certain they didn't. And recent developments have shown that maybe not all security researchers think the same. Most of the time we talk about good hackers, white hat hackers, finding vulnerabilities in medical devices. Most of the time they take those vulnerabilities that they find and they give them to the manufacturer and they say, this is your vulnerability, you need to fix this. A group of security researchers in a company called MedSec found vulnerabilities in some pacemakers. And instead of going to the manufacturer to help fix the problem, they went to like a pseudo hedge fund called Muddy Waters. They partnered together and they said, we're going to release this report that shows that these pacemakers are vulnerable. We want to partner with you to short the stock. And arguably for some time, maybe not really, it did impact the stock. Now this has since turned into a big deal, and I'm sure we'll see updates from this moving forward. But it showed maybe an alarming trend in the future of this because we know these types of vulnerabilities just keep getting bigger and bigger. And many people question whether or not this caused a crisis of patient confidence, whether or not events like this cause our patients to question the devices that are implanted in them, the devices that they're connected to in the hospital. Many people say it didn't cause a crisis of confidence. I'm not sure, but I do think that if it does happen, it's going to happen soon.
And we are reminded on a near daily basis now that these types of threats are not going away. A couple of weeks ago, while we were putting the finishing touches on this event, there was an unfortunate but timely reminder that this continues to be a threat we as clinicians need to be aware of. I'm sure you heard about the WannaCry ransomware virus, which swept across hundreds of thousands of computers across over 100 countries, and perhaps most dramatically affected the National Health Service in Britain, causing the shutdown of dozens of hospitals, resulting in canceled surgeries, delayed doctor's appointments, and emergency rooms that told patients do not come and seek care unless you are critically ill. These types of events, aside from being very dramatic in the media, these have costs. Because what we need to understand, and many clinicians do, is that healthcare itself is very fragile. There's an interesting article that was recently published in the New England Journal that took a look at this. I find kind of interesting. Who here has tried to drive across town when a marathon's going on? And the roads are closed, and it's impossible to get from point A to point B. It's even worse when you're having a heart attack. So this paper took a look at patients who were taken by ambulance to seek care in centers both before and during a major marathon occurring in that area, closing roads. And they found that there was a statistically significant rate of increased mortality when the marathon was in town. And if something as simple as closing a couple of roads can be deadly for our patients, what happens when the entire infrastructure that supports them at the hospital is taken down? Like, this is a big deal. And we feel that it's very worth talking about. What we don't want to do is be alarmist. We want to be realistic about these types of threats. And we don't want to throw away the incredible advances that we've made with technology. Christian and I don't feel that this is an either-or proposition. It's possible to have amazing technology, and it's possible to secure it. But we as physicians are responsible for protecting our patients from risk. We have to learn about disease in school. We have to learn about what drugs to give. We now have to learn about the social determinants of health because we understand that there are lots of outside factors from medicine that affect our patients. This is an equally important topic, and it's one that Christian and I feel that we should be more involved with as clinicians. And this question, how are we going to fight back, it keeps us up at night. And so in some discussion and collaboration with people that you're going to meet throughout the next 2 days, we decided the best thing that we could do would be to start a conversation. And when kind of taking a look at this space, we understand that there are many people and organizations that are important in our goal. Okay, so we have us, we have other members of the clinical team that care for patients at the bedside. And we need to be working with the security researchers, the good guys, the hackers that find problems and fix them and make systems stronger. We need to work with the device manufacturers that make these incredible technologies who are also interested in ensuring that our patients are safe. Hospitals, they allow us to care for patients. They're our partners. Policymakers who can help us with regulations to ensure that patients are protected at all levels of the market. The law enforcement individuals who look out for us. These are all important people to bring to the table and to start conversations. And we hope that that's what we've started to do here today, building these networks, bridging these networks, and ensuring that ultimately we are all working at the behest of the most important stakeholder of all, our patients, the public, you guys.
So we were very fortunate to partner with the University of Arizona College of Medicine Phoenix, our alma maters, in addition to the Atlantic Council. And additional co-founders of this conference include Bo Woods and Josh Corman. It's really been an amazing ride trying to figure out how to get this problem solved. And I don't think we're going to do it anytime soon, but this conference is the start. We were able then to secure some sponsors. We're very thankful for your contributions. And because of that, we were able to bring so many other people to the table, only some of which are represented on this screen. You look up there, there's a lot of great, smart, intelligent, capable people here sitting next to you. Take advantage of that, because this is going to start a conversation of who else we should be inviting in to talk to. who else we should be collaborating with. This is the start. This is not the end of the list. It needs to be longer because this problem touches so many lives. We want to say thank you for coming. Your voice is appreciated. You are very needed, every single one of you today. Advocate for yourself, for your patients, for your family. This is important. We want to say thank you for coming.
One of the things that we're able to do with the support from our generous sponsors is open up these keynote sessions to the most important stakeholders, our public. And so we're very excited that you're here. We hope you stick around with us. Later this morning, we have Josh Corman, who is the director of the Cyber Statecraft Initiative at the Atlantic Council and was on the HHS task force. And we'll let him talk about that, but it's an incredible person to be able to talk about how these issues matter at the policy level. Tomorrow, we have an amazing lineup. Scott Irvin, who is a world-class security expert. Dr. Suzanne Schwartz from the FDA is an amazing individual. We are so happy to have her here. And Dr. Marimo, we're so thankful that she came out as well. She is an amazing individual with intersections in the security research and patient sphere that's going to be really compelling. So if you haven't signed up officially for those days, we have plenty of room. We hope to see you back. They're going to be an amazing couple of talks.
Those talks are in the same room tomorrow at the same time. We also, while we have you here, want to give some brief thank yous. This is not an exhaustive list. We have an Oscar level list, if you will, of thank yous. But briefly, we wanted to thank Sheila Maddox, the manager, special events here. We call her the mover of mountains and conference rooms.
Allison Otu and the entire rest of her team, I mean, we're going to thank them individually, but we just have to say, you guys have done such a great job. Allison is the MVP of the CyberMed Summit. We could not have done it without her, and we love her a lot.
And last but not least, we'd like to thank the leadership of Dean Ramos, which about a year ago, when we came to him with this idea, he was very supportive of, and because of his leadership, this is possible. We could spend 30 minutes introducing this next gentleman that's going to speak to you, but we would not even scratch the surface of his accomplishments. This gentleman, who is a prolific hacker of policy, a computer hacker himself, and the deputy director of the Atlantic Council's Cyber Statecraft Initiative as well.